Before we begin, a quick note. The opinions and analysis shared on Truth Seekers are our own interpretations of published research and should not be used as medical, financial, or professional advice. Always consult qualified professionals for decisions affecting your health or well-being.
And with that out of the way, welcome to Truth Seekers. I'm Bill Morrison.
And I'm Alex Barrett. Today is December 31st, 2025, and we're talking about the Ozempic babies panic, when weight loss drug headlines miss the actual story.
Let's get to the truth.
So there's this wave of headlines about Ozempic babies, women getting unexpectedly pregnant while taking GLP-1 drugs like Ozempic or Wegovy. The framing is essentially hidden pregnancy risk. Drug companies aren't warning you. It's this shocking side effect women don't know about.
Right, and it sounds terrifying if you're a woman considering these medications. Like you're trying to lose weight and suddenly, surprise pregnancy.
Exactly. And it's based on a real study from Australia published in the Medical Journal of Australia. Nearly 11,000 women, 2.2%, became pregnant within 6 months of starting these drugs.
2.2%.
Yeah, that sounds actually concerning.
Does it? I don't know. What's the pregnancy rate supposed to be?
What do you mean?
Like, if you take 11,000 women who aren't on these drugs, what percentage get pregnant in 6 months? Just normally.
Ah, right. That's where this gets interesting. The study didn't have a control group.
Wait, hold on.
Hmm.
They're claiming the drug increases pregnancy risk, but they didn't compare it to women not taking the drug?
Correct. They just measured, here's how many women on GLP-1s got pregnant. Full stop.
Okay, so someone else must have done that comparison, right? Please tell me someone did.
They did. Epic Health Research, massive study, October 2024. They looked at over 27,000 women prescribed GLP-1 medications and matched them with 180,000 women who weren't prescribed these drugs. Same age, same BMI, same fertility conditions.
Okay, that's a proper control group. What did they find?
Pregnancy rates were identical. Women not on GLP-1s, 3.86%. Women on semaglutide, 3.42%. Liraglutide, 3.98%. Basically the same across the board.
So when you actually do the comparison, there's no elevated pregnancy risk at all.
None. Which means that 2.2% from the Australian study, that's not high. It's actually lower than the natural rate. But without context, it got spun as this alarming drug side effect.
This is this is wild. The number that sounds scary is actually below baseline.
Yeah, but here's where it gets more complicated. Some women are definitely getting pregnant while taking these drugs, and there's a whole social media phenomenon around it. So, what's actually happening?
Right. Okay. So if the overall rate isn't elevated, but there are these stories.
This is where the study's actual findings get really important. The researchers found that women with PCOS, polycystic ovary syndrome, were twice as likely to conceive compared to women without it.
PCOS causes infertility because it disrupts ovulation, right?
Yeah, and here's what the study authors actually said, quote, suggesting that weight loss may improve fertility even when unintended. They explicitly attribute this to weight loss restoring fertility, not the drug causing pregnancy.
Oh, hang on. So, women who couldn't get pregnant before because of obesity related infertility lose weight on these drugs and suddenly can conceive.
Wait, this feels familiar. Didn't we?
What?
The Alzheimer's episode with the GLP-1s. The whole thing where everyone thought the drug was helping with dementia, but it was actually just the weight loss and glucose control doing the work, not the drug itself.
Oh, right. Yeah.
It's the same pattern. The drug gets credit or blame for something that's actually the weight loss.
Okay, yeah, that's a good catch. So the mechanism here isn't pharmacological, it's just weight goes down, fertility comes back.
Exactly. And check this out. Only 21% of women in the study were using contraception when they started the medication.
Wait, 79% weren't using birth control?
79%.
That's okay, but is that actually unusual? Maybe they weren't sexually active, or.
Well, yeah, or they had been infertile for so long they didn't think they needed it.
Right. Which suggests these aren't women who were actively preventing pregnancy and then the drug somehow broke through their contraception.
These are women who either weren't sexually active or had been trying for years and given up, or just didn't expect to conceive.
So the actual story here is women with fertility issues lose weight, become fertile again, aren't using contraception because they didn't expect to conceive, and then, surprise.
That's what the data shows. But the headlines made it sound like the drug itself pharmacologically causes pregnancy, like it's interfering with birth control or boosting fertility directly.
Did anyone actually study whether these drugs affect birth control effectiveness? Because that's what a lot of the coverage implied.
They did. There's a systematic review from 2024 in Drug Safety, 22 pharmacokinetic studies examining how GLP-1s interact with oral medications. Their finding on oral contraceptives. The overall drug exposure was not considered clinically significant.
Meaning the drug doesn't reduce how well birth control works.
Right. And there's a specific 2015 study that tested semaglutide, that's Ozempic, with combined oral contraceptives. Direct quote, does not reduce the bioavailability of birth control.
So that's two separate pieces of evidence that the drug isn't breaking through contraception.
Correct. Which makes sense because GLP-1s don't work on reproductive hormones. They work on blood sugar and appetite regulation.
Okay, so let me make sure I'm tracking this. The claim is drug causes unexpected pregnancies. But what actually happened is drug causes weight loss. Weight loss restores fertility in women who had obesity related infertility. Those women mostly weren't using contraception. Some got pregnant.
That's it. And honestly, this is so frustrating because it's exactly the kind of story manipulation I used to see in journalism. The headline and the actual research are telling completely different stories.
But wait, I want to push back on something here.
Go on.
You said the Australian study didn't have a control group, and we've been kind of dismissive about that. But they weren't trying to prove the drug causes pregnancy. They were documenting that pregnancies are happening in this population.
Okay.
So maybe the missing control group isn't actually a flaw. Maybe it's just descriptive research. The problem is how it got reported, not how it was designed.
Mm, I mean, that's fair, but they're still making the claim that weight loss improves fertility in PCOS patients. And that's causal language without.
But they're citing established research on weight loss and PCOS fertility. They're not claiming to prove it, they're applying what we already know.
Right. Okay. Yeah. I think you're right, actually. The study itself is fine for what it is, it's a surveillance thing. The problem is entirely in how it got translated to headlines.
Which is even more frustrating in some ways.
How so?
Because the researchers were pretty clear about this. They said it's about improved fertility from weight loss, especially in women with PCOS. So, how did that become hidden drug risk?
Because weight loss medication helps infertile women conceive isn't scary. Hidden pregnancy risk from blockbuster drug gets clicks. When I was covering health stories, this was the constant pressure. Editors wanted the alarming angle,
And meanwhile, the actual issue gets buried.
which is,
That 79% not using contraception. That's a healthcare communication failure. If you're prescribing a weight loss drug to a woman with PCOS or obesity related infertility, someone should be saying, you might become fertile as you lose weight. Let's talk about contraception if you don't want pregnancy.
the Australian researchers actually called this out. They said the main issue is inadequate contraceptive counselling in clinical practice. Women aren't being warned that fertility might return.
Right. So the real hidden risk isn't the drug, it's that doctors aren't having this conversation.
And that's actually really important because these drugs are being prescribed for a different reason than they used to be. The Australian study found that in 2022, over 90% of women getting GLP-1s didn't have type 2 diabetes. They're getting them for weight loss.
So you've got this population of women, many with PCOS or obesity related fertility issues, getting prescribed these drugs primarily to lose weight, and nobody's saying, hey, you might be able to get pregnant now.
And then when pregnancies happen, it gets framed as the drug causing it rather than doctors failing to counsel patients.
Although, I don't know, is 79% really that shocking?
What do you mean?
Like, if you've been infertile for 5 years, you've probably stopped using birth control. That seems pretty rational to me.
But that's exactly why the counselling matters. The doctor knows, or should know, that weight loss can restore fertility. The patient doesn't.
Okay, yeah, fair point.
The other thing that bothers me about this framing, it could actually harm women who need these medications.
How do you mean?
If you're a woman with PCOS who struggled with infertility and obesity, and you see headlines about Ozempic babies and hidden pregnancy risks, you might avoid a medication that could genuinely help you, not just with weight, but potentially with fertility if that's something you want.
Oh, that's interesting. So the scary framing could prevent women from accessing something that might actually help them conceive if they're trying.
Right. Or if you're on the drug and do want to get pregnant, you might stop taking it thinking it's dangerous, when actually the concern is about fetal exposure during pregnancy, not about taking it before conception.
What's the guidance on that?
The FDA and other regulatory agencies recommend stopping GLP-1s 2 months before trying to conceive because animal studies showed some fetal growth restrictions. But that's different from saying the drug causes pregnancy or that you shouldn't take it if you might want kids eventually.
So we've got this bizarre situation where the drug gets blamed for pregnancies it didn't cause, which might scare women away from medications that could help them, while the actual issue, inadequate counseling, gets ignored.
And look, I do think there's a kernel of real concern here that got completely mangled in the headlines.
Which is?
If you're going to become fertile again through weight loss, you should know that. You should have the information to make choices about contraception. The problem isn't that these pregnancies happened, it's that they were unexpected.
Because nobody told these women it was a possibility.
Right. And some of these women probably would have been thrilled to know weight loss might restore their fertility. Others would have wanted to use contraception, but they needed the information to make that choice.
Hmm, yeah. So, what should someone actually know if they're considering these medications or already taking them?
First, the drug itself doesn't cause pregnancy as a direct side effect. Your pregnancy risk on these medications is the same as someone not taking them, all else being equal.
Second, if you have PCOS or obesity-related infertility, losing weight, whether from these drugs or any other method, can restore ovulation and fertility.
Which means if you don't want to get pregnant, you need to use contraception. The drugs don't interfere with birth control effectiveness.
And if you do want to get pregnant, talk to your doctor about stopping the medication 2 months before trying to conceive because of the fetal exposure concern.
The bottom line is this isn't a hidden drug risk. It's a healthcare communication problem that got reframed as pharmaceutical danger.
And the fix is actually pretty simple. Doctors need to have these conversations when prescribing these medications to women of reproductive age.
Which some are doing, but clearly not enough based on that 79% figure.
This is one of those stories where the sensational framing makes everyone worse off. Women who could benefit avoid the drugs. The real issue doesn't get addressed, and we end up with Ozempic babies as shorthand for something that isn't actually happening the way people think.
Yeah, and it's worth noting if you see a headline about a drug causing unexpected side effects, it's worth asking, did they compare to people not taking the drug? Because without that comparison, you're just seeing numbers in a vacuum.
The 2.2% sounded meaningful until you learned 3.8% is normal.
Exactly. Context is everything. And in this case, the context completely changes the story. Right, that's all for today's dive into the data. Just remember, everything we've discussed is our interpretation of published research and shouldn't replace professional medical advice.
Absolutely. If you're dealing with health or mental concerns, talk to your doctor, not just us data nerds on a podcast.
I'm Alex Barrett,
And I'm Bill Morrison
and we'll see you next time.
on Truth Seekers.
Until then, question everything.
But verify with data.